This is an educational video for patients who have been affected by having a stroke. This video should only be used under the guidance of a physiotherapist. We'll be talking about the shoulder joint in particular and how this can be affected after having a stroke. The shoulder joint is a very mobile joint and we must be mindful of how unstable it can become after having a stroke. Sometimes when the muscles become weak around the shoulder joint, it can cause the ball, which sits inside the socket, to move more freely, and this can cause a partial dislocation, or in other words, a subluxed shoulder. This can be very painful for patients during the rehab process if not managed correctly, and it can also cause chronic pain in the future.
That's why it's important when handling an arm after someone's had a stroke that you position your hand under the elbow and on the wrist. And it's also good practice to put an upward pressure to prevent any further dislocation or subluxation. Also, when positioning the arm, try not to pull the arm or overstretch it, because that can make the pain worse and obviously cause further damage.
This video is a demonstration of how to position an affected upper limb after having a stroke. This video must only be used when guided by a physiotherapist. Firstly, we will look at recreating the optimal position for an upper limb when seated in a chair. The patient must be seated in an upright position with their weight distributed equally in the chair. When handling the upper limb, you must place one hand underneath the elbow and one hand underneath the wrist. This will help to de-weight the shoulder enough so that the shoulder joint is not pulled downwards. Place the arm out to the side so that it's in line with the shoulder joint. 1 or 2 pillows can be used for this. At times, due to lack of use after having a stroke, the arm can become swollen and quite edematous. For this reason, pillows are used to help elevate the arm. Sometimes we use a rolled towel. This can be placed into the palm, which will move the wrist into a more neutral position. This is a much more functional position and can be very useful for a patient's rehab.